Hello and welcome back to Anderson County Serves Here. Thanks to Anderson County Administrator Rusty Burns and County Council for allowing me, Carol Burdett, CEO of United Way of Anderson County, the opportunity to bring you messages about how people in Anderson County are being served. Some of them are being served through nonprofit organizations, civic clubs, or government agencies. We want people in Anderson County to find the resources they need, the tools that will help them live better lives and thrive, not just survive. Today, we're going to be talking about mental health and behavioral health. Prior to COVID, my board chair, Greg Shore, talked a lot from his perspective as the coroner and as the owner of MedShore Ambulance Service, the effects of mental health and behavioral health. It planted a seed within my mind about how could United Way begin to help address some of these issues in the community. Because you see, not one agency, not one organization, not one person, not one church, not one anything is ever going to help solve the problem that we're seeing in our community through mental health issues or substance abuse disorders. These are things that it takes all of us working together to do. So prior to COVID, we had some community conversations hosted by United Way. We brought in professionals that are working with mental health. We brought in professionals that are working in the area of behavioral health services. And we had them talk about what their agencies or organizations were doing. It was very enlightening. One of the things that I took away from that was that about 70% of people who suffer from mental illness self-medicate. And that grows into an addiction or a dependence on substance abuse. And so, with all of that being said, we definitely knew there were things that we had to do in our community if we're going to work together to help solve these problems. Over the past 10 years, I've had the opportunity to serve on the board of the Anderson Oconee Pickens Mental Health Center. That is part of South Carolina Department of Mental Health. I could hardly believe what I was learning about the numbers of people in our community that suffer from mental illness. I'm sure if I were on the board of the Anderson Oconee Behavioral Health Services, I would see so many of the same issues. No one organization or no one agency, no matter how good they do, can do this alone. This is about partnerships. And as I talk today, I don't want anybody to walk away thinking United Way is trying to take credit for what other organizations are doing. No, our job is to convene people around issues. And that's what we're doing around mental health and behavioral health. It's about partnerships. And we're going to learn about some of the great things that are being done by Anderson County, by the Criminal Justice Coordinating Council, by AnMed Health, by organizations like Favor and others that are making an effort to get people the help that they need.
As the world begins to navigate a new normal with COVID-19, we have learned and experienced a lot in the last 2 years. COVID-19 has been called the Great Equalizer, but it will also be known as the Great Revealer.
So I think COVID's taught us a lot of things. I think mental health, there's always been a need there and there's always been a gap as far as resources, but I think COVID has brought mental health to the forefront, and we've all seen people that we know and that we love, they've struggled with, the loss of jobs or the loss of other family members, and just the need for taking care of our own mental health and how important this is to everybody. There's always been a stigma with mental health, and people think, that's not my issue, or they can't relate to it. And I think the pandemic has brought that close to home, and a lot of people have seen the effects of that. So mental health care and having the proper resources in our community is even more important than it ever has been.
In 2021, AnMed Health's Community Health Needs Assessment revealed that the most often and top-of-mind health concern for adults was mental health. Behavioral health services is a great need for our community. The expansion and relocation of behavioral health services.
I'm just so inspired by the connection with stakeholders and friends that we have in the community. In the short time I've been here, we've been blessed to get to know so many of these folks, and it is what gives us an opportunity to truly be exceptional, and I'm very grateful for that. And just on behalf of our employees, our providers, our physicians, and most importantly, our patients and families that look to us, just want to say thank you. Can't say thank you enough.
As AnMed Health convenes the resources to meet this need, 1 in 5 South Carolinians have a mental health diagnosis that goes untreated because they lack the access needed to improve their health. AnMed Health has launched a campus initiative to relocate and expand behavioral health services to include a new intensive outpatient program and expand the inpatient program from 27 to 38 beds.
So the intensive outpatient treatment, the goal for it is to help patients who are not severe enough to be admitted to the hospital, but they're not completely well to follow the outpatient treatment. It's in the middle of the patient, so we're able to save the patient from admission to the hospital. They can continue with their work, continue with their activities, continue to be with their family, and continue to follow also the outpatient treatment. I think it's going to add significant tool to our tools in order to help our patient. And the most important thing is keeping them in their regular life, follow up with the treatment, and maintain their work, maintain their activities, maintain their support as an outpatient.
The new space is set to be opened in the fall of 2022. We can all celebrate that we have contributed to meeting the needs of the most vulnerable in our community.
There are very few families in Anderson County that are not affected by mental health or behavioral health issues. In fact, 1 in 5 people in the country are affected by one of these issues or both. In fact, it is nearly 1 million people between 1999 and 2019 committed suicide. These are astronomical issues that have been exacerbated by COVID. You see, during COVID, I think that what we saw were issues that were uncovered, that were discovered, and we found that we have an epidemic of people who need help. It could be someone in your own family. And what we want to do is help you find information and resources that are available to you and your family as you work through issues of mental health or behavioral health within your own family and circle of friends. About 18 months before COVID, United Way had the opportunity to send some volunteers to be trained to be mental health first aid facilitators. Now, this doesn't mean that they are mental health professionals. What it means is they are able to facilitate a training that helps people like you and me, lay people in the community, recognize the signs of mental illness. And it helps those of us who are normal, everyday people know about the resources and how to direct that person to the place that they can get help. We continue today to offer mental health first aid classes. If you are interested, it is a phone call to United Way for you to sign up to get this training. Our number is 864-226-3438. Or you can email us or check on our website. We are very easy to find at the corner of Murray Avenue and Greenfield Street. We need more people that are trained. We need more facilitators. If this interests you at all, we'd like for you to contact us. Some other partnerships that we have at United Way, where we feel that we are able to support and help organizations do their jobs better in the area of mental health and behavioral health. That includes partnering with NAMI. NAMI provides a long laundry list of ways that they help people in our community that suffer from mental illness or support their families. But one of those is Go Lime Green. I hope you'll be watching as football season starts in the fall. We're going to be supporting and sponsoring Go Lime Green events at high school football games, because these issues are not limited to adults. We have far too many children and youth who are also suffering from mental illness and are needing help. And we want to help to remove the stigma of mental health issues. We want people who need help to be able to reach out and get it and not feel that someone is going to ostracize them. So watch out for Go Lime Green this fall.